Hi, I'm Dr. Alan Wulc, and we're talking today about festoons. In 1964, Supreme Court Judge Potter Stewart talked about pornography, and he said, pornography, you know it when you see it. He said, I know it when I see it. Well, festoons are the same. You know them if you have them. You know what they are. We have a lot of traffic to our website because people are troubled by festoons. They are at the lid and cheek junction, areas of swelling that occur. They can be worse in the morning, but they're almost always present. You see them in the mirror, and when you combine them with a fullness under the eyes that occurs as we age, you have a convexity, concavity, convexity deformity that makes you look abnormally old. The festoons can collect edema. They can look wet, so that almost like you could stick a needle in them, and those are called wet festoons for that reason, but they're also dry festoons. Well, what causes festoons? Festoons are caused by thyroid eye disease, by rosacea, and by sleep apnea. Those are the conditions that we actually associate with festoons, but more commonly than not, they can be familial. And what we're seeing more and more in our practice is festoons related to hyaluronic acid fillers. Hyaluronic acid fillers are put under the eyes to obscure the tear trough, the hollow that exists between the puff of the lid and the cheek, to sort of fill that area up. And unfortunately, even though they have great use and they do obscure that problem, with time they clog the lymphatics in the lower eyelids and cause this swelling that occurs right at the lid cheek junction, where the muscle that closes the eye actually fuses onto the bone. So what we do in those circumstances, it's pretty simple. We dissolve the filler. Filler is dissolved with an enzyme that dissolves the synthetic filler more than it dissolves our own hyaluronic acid. The enzyme actually is introduced 1 to 3 times using a needle or a blunt needle. Usually you don't get bruising, but what it does is it creates the problem that you had in the first place. So you have a tear trough again. A lot of times what can be done is another injection with filler can actually solve the problem, perhaps with a different type of filler, a lighter filler, and sometimes surgery is actually necessary. Eyelid bags are completely different. Eyelid bags form because we get puffs under our eyes, fat under our eyes that actually increases in amount, and the septum, the tissue, the connective tissue that sort of holds things back, actually weakens. The cheek actually drops, and there's an area of bone loss at the orbital rim right here at the bottom under the eye. When all those things sort of compound, it creates a problem that becomes really visible. It makes you look tired. So when you have the concavity created by the tear trough on top of the convexity and the convexity of the festoons, so it's natural that you want to do something about it. It's very hard to correct. So how do you treat festoons non-surgically? Well, in our practice, we have radiofrequency energy treatments. Radiofrequency can be just applied to the skin. It can be used underneath the skin, but we introduce the radiofrequency energy, which is like radio wave energy, into the skin using microneedles. So radiofrequency microneedling is well described for treating acne, scarring, and wrinkles, but it works beautifully on the face, whether it's festoons. Well, how does it work? The needles that are introduced are charged. The energy causes the changes in the collagen that tightens them, and it actually injures and heats the fat underneath it, causing the fat to actually contract and improves the festoons. We put cream on that numb the skin. After that, the treatment is maybe 15 minutes in duration. You can get black and blue from it. You do it 3 times, spaced out by about a month, and you see changes that occur somewhere between 1 month and 36 months after the treatment. We have really good response to it. We've seen that in our patients. We've actually submitted a paper to the Aesthetic Surgery Journal for this. Another option that's done in the office is the injection of doxycycline. Doxycycline is an antibiotic like tetracycline. It's used to treat infections, Lyme disease, but it also can be used for us as a sclerosing agent. It actually causes contraction and scarring, and that can produce improvement. And that's also done more than once. It's actually very painful, and so what we do is we actually do it with sedation in the office. You can get very black and blue from it, but it does work. We haven't had the same results that are consistent as we have with radiofrequency microneedling. So often what we'll do, if the radiofrequency microneedling doesn't work, is we'll take the patient to the OR and consider a surgical option. What are our surgical options? The most common, has to be in the right patient, is a laser resurfacing. The energy of the laser, which is light-based energy, causes the contraction reformation, tightening of the collagen. It doesn't do much to the underlying fat, but it does produce results. These initial results were reported by Sterling Baker back in the last century. We have an erbium laser which we use for this, and we have fairly good response. The laser can also be repeated in general, though it's one and done. Other treatments that have been described are mid-face lifting, where the face is actually lifted using an incision of the hairline in the temples to lift the festoon up. That alone, I don't think produces the same kind of results as you would get with a laser, but often in cases that are advanced, that's the best option, a laser plus a mid-face lift. And then in cases that are recalcitrant, that just won't get better, what's described is actually a direct excision of the festoon. So the festoon is actually just cut away, but you're left with a scar. The scar can be long. If the festoon goes this far, you have to cut that much, and you have to take all the edematous skin away. You can treat the underlying fat with energy while you're there because you see the fat, and you also can remove some redundant muscle. But you always have a scar there, so it's not desirable treatment. The scar can be treated with a laser. We generally do the laser at the same time, and then we also repeat the laser again at 6 weeks. So in conclusion, festoons are the bane of existence of most plastic surgeons. We're lucky to have these options and experience with treating patients with festoons. If you'd like to make an appointment or send us a picture of the concern that you have, we'd be happy to get back to you and talk about it, perhaps arrange a consultation.